tonight, Mr. Pierce.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Don't be picking at me, pretty. You know how I is.
Thank you, Mr. Pierce. Next, we move to 1B, correspondence, Ms. Barrios.
We have a thank you card from the Pleasance Lane administration and faculty and staff, and it reads, directed to our school board, and it reads, "The difference you make makes all the difference. To the Petersburg City Public Schools school board members, hope you know how much you're appreciated. Thank you for all you do for our students, families, and staff. Principal Michener and the Pleasance Lane Elementary family."
Thank you. And also to Ms. Michener and her staff at Pleasant Lane, on behalf of the school board, we would like to say thank you for the box of chocolates that you sent, and hopefully there's a piece left for me. We'll move next to number 2, recognitions, Dr. Petrie Martin, 2A.
So good evening to all assembled and greetings. It is always a pleasure for me to present our VIPs for this month. That stands for Virtually Important Professionals. Petersburg City Public Schools recognizes our teachers and staff who do great work to support students and families. And we have a substantial list of VIPs this month that I will read. Beginning with Cool Spring Elementary School, we have Natasha Batts, Robert Bow, Shanna Finklin, Ashley Huckabee, Eva Greenwood, and Naku Walker. From Lakemont Elementary School, we have Tracy Elliott, Ebony Holmes, Laurie Hopp, and Donald Payton. From Pleasance Lane Elementary School, we have Shelley Cook, Melinda Johnson, and Jacqueline Ownsby. From Walnut Hill Elementary School, we have Natasha Bonnet, Jennifer Clayton, Cortez Dixon, Sheena Hill, Nisha Jones, Susan Moss. From Westview Early Childhood Education Center, we have Danielle Branch, Mary Cody, and Laurie Summerlin. From Vernon Johns Middle School, we have Emerlina Baninya, Courtney Davis, Kristen Moore, and Crystal Wakeham. From Petersburg High School, we have Elizabeth Boyd Price, Jay Matthews, William Steele, Cinnamon Terry, and Catherine Tucker. From Blandford Academy, we have Kimberly Edmonds Best. And from Central Administration, we have Estella Bishop, Lorna Keynes, Patrice Gabolt, Brenda Jones, Renee Mayu, and Crystal Tompkins. And from Central Administration Nutrition Services, we have Donna Dillard and Vanessa Wynn. Please join me in giving all of our VIPs a round of applause and congratulations for the great work that you do for our students and our families.
Thank you, Dr. Petrie Martin. Congratulations to everyone on behalf of the Petersburg School Board. At this time, board members, we'll move to 3, approval of the consent agenda to include our personnel and also to include our minutes for January 13th, 2021. At this time, is there a motion to accept the consent agenda?
So moved, Mr. Chair.
Moved by Mr. Pierce. Is there a second? Who is it? Mr. Dance?
Yes.
All in favor?
Aye.
Opposed? Motion carries. Next, we come to number 4, our superintendent and staff reports. Dr. Petrie Martin, 4A.
So the first report that we have today are policies for first review. We have 2 regulations that we have revised and we're bringing forward. We also have a school closings policy that we have revised with additional information. And then we also have a social networking policy that we have created and brought before you today. So I will turn it over to Dr. Johnson.
Thank you, Dr. Petrie Martin. Good evening, Chair Pritchett, Vice Chair Pierce, members of the board, ladies and gentlemen. As Dr. Petrie Martin shared, there are 4 items for your consideration, beginning with the regulations BDDH-R/KD-R and KD-RBDDH-R. These are regulations, they're mirror regulations. BDDH-R is found under Section B, School Board Governance and Operations, and KD-R, School Community Relations. Both are public participation at school board meetings. The recommendation is that these regulations be deleted and that the board, in its stead, adopt a protocol for public comment. The regulations are rather lengthy, and the protocol for public comment would help clarify the process by which the board receives public comment. Item number 3, E, B, C, D, school closings. This policy is being revised to include the mediums used to communicate school closings or delays due to adverse weather conditions or other emergencies. The substance of the policy remains consistent with VSBA policy EBCD. Item 4, GADA, the new policy, Petersburg City Public Schools employee use of social networking sites. This policy was developed with guidance from legal counsel. It is designed to clarify employee roles, responsibilities, and expectations for establishing and/or using social networking sites. These are the 4 items before the board for your consideration.
Thank you, Dr. Johnson. Any questions from board members about the information she has presented? No questions. Thank you, Dr. Johnson. We appreciate it.
Thank you.
Dr. Petrie Martin, we move to number 4B.
The next item that we have for you this evening is a standing monthly item, and this is a review of financial reports. I will turn it over to our finance director, Ms. Holloway.
Thank you, Dr. Petrie Martin. Good evening, Chairman Pritchett, Co-Chair Pierce, school board members, and Dr. Petrie Martin. Tonight we bring you the financial reports for January. We're going to start with the operating fund. In the operating fund, our budget is $45,906,969. That's our revised budget. The month of January, we spent the year to date, we've spent $23,333. We have a balance of $22,573 at this. So we've spent 50.83% of our budget, and at this time last year we had spent 50.24. So just a little bit over what we had last year. That was on the revenues. So actually I said we spent, but we brought in that much revenue in the month of January. So expenditures, we have it broken down by each category. I won't go through and read all these boring numbers to you all. If you just go to the second page at the very bottom, it shows the grand total. In the operating fund, we spent $3.785 million the month of January. For the year, we've spent $20,686,765, and we have encumbered a little over $500,000. So for the year, we have spent 46.21% of our budget. This time last year, we had spent 49.37%. So that's the operating fund. If anybody had any questions about that before we move on to the next one.
Any questions from board members? Any questions?
Just one, Ms. Pritchett.
Mr. Pierce?
Just want to, I always ask the question, do we have any issues at all with transfers from the city?
No, sir. They are all caught up. At the very top of page 1, you can actually see the, there's a separate line for fund transfers. And as of right now, they have transferred over half of a year's worth, which they should have. So they've given us 6.355 million at the very top of the revenues for the year. And actually, you don't see anything for January because they gave us January's payment in December.
December, okay.
They gave us 2 payments.
All right. Thank you, ma'am. Thank
Yes,
you,
sir.
Mr. Chair.
Okay, we're going to move on to the food service fund. Okay, at the top are the revenues for the year. We have a budget of $3,032,000. We brought in the month of January $162,321. Year to date, we have brought in $825,648, which is only 27.23% of our budget. At this time last year, we had brought in 46.4% of our budget. So you can see that we are really low on the revenues in the food service fund, mostly because we haven't gotten all of our state revenue yet, of course, or federal, but the local is way down because we're not in school. And the expenditures at the bottom, you can see in the month of January, we spent $138,081. Year to date, we've spent $902,873. We have $800,000 encumbered. Most of that is for food for the kids. So our encumbrances are $804,000, which together with the expenditures is 56.3% of our budget in food service. This time last year, we were at 71.39%, but that did include a lot higher encumbrances for food at that time last year. Any questions on the food service fund?
Just one.
Any
Yes,
questions?
sir.
Mr. Chair. Usually when I see something that kind of pops out at me, you see where that line item that talks about other expenses, 5,000, what would that budget line item consider as other expenses?
Object code 5000 includes anything like rental of like copiers, any travel, any dues and memberships that might be paid. Those kind of things are considered other.
Okay.
Cell phones, any utilities, which food service doesn't have utilities, but those would fall under 5,000.
Okay. All right. Thank you, Mr. Chair.
Any
Thank
other
you, Ms.
questions?
Howard.
Yes, sir.
Mr. Lundy?
Yes. Can you hear me, sir? Yeah. In the operation fund, I've always, we haven't, I guess as a whole, the board can never really tell how much we profit off of our rentals and all. And I've often wondered about that. How do we manage to acquire?
We do have a separate line item in the revenues for collection of rental property. We have not had any this year of it. We usually have rent out that dance studio. We don't have that going on this year with everything being virtual. We do have about 8,295 in there for this year. And some of that, I believe, without knowing off the top of my head, is for that movie place that came into the high school. That's the only thing we have in that line this year so far.
Right. But otherwise, when we do show that, is there a way that we can actually see who we are renting to?
Sure. Yes, sir. We can put a list together for you.
Because you never really know, are we becoming financial lucrative, in this situation of renting?
Yes, sir.
Thank you.
I will put together something for you all.
Thank you.
You're welcome. All right. So if we're ready, we'll move on to the grants fund. Okay, grants fund, the revenues are at the top like the others. Right now, we started out with a budget of $8.5 million. We have added to that $9.4 million. Most of that is CARES money that we've received this year, as well as some newer grants. So our revised revenue budget is $17,908,000. And in January, we brought in almost $950,000 in reimbursements. And year to date, we have brought in almost $7.3 million, which is 40.72% of our budget. This time last year, we were at 33.63% of our budget. On the expenditure side, If you scroll down to the very bottom on the second page, the grand total we have, of course, is a revised budget of $17,908,000. The month of January, we spent $1.3 million. The year to date, we spent right at $8 million, and we have a $950,000 encumbered. When you put the year to date and the encumbrances together, that is 49.63% of our grant budget. This time last year, we were at 36.37% of our budget. And that is my presentation for the financial reports for January. Does anybody have any questions about the grant fund?
Mr. Pritchett.
Mr. Lundy?
I did have one question and I don't know if we ever got on this topic before, but it was when we were talking about the movie, we were trying to find out, would we be gaining from this? And we were going to try to find out what we would compare that to, and whether we were actually getting funding that would be helpful to us, or were we just getting level funding? And we said we were going to try a way to find out how we would compare that. And so I thought about that when we were talking about the movie, our finances, as far as our finances were concerned.
We can go ahead and bring that to you. We started research after we had that conversation to look at other school districts of comparable size and see what they were charging. I think our assumption is that they were charging more than what we have been charging for rental. So we can kind of bring you a report on what we have discovered. And in all honesty, I think the board can certainly look at changing some of the fees that we have to get to, I think, what you would like to see, which is that we're benefiting. It's not just covering costs, but we're benefiting.
Yeah.
So we can prepare that and bring that to the board. For discussion.
Because sometimes our rentals go on who's in the city. And so we're not making monies like that. Mm-hmm. And that's one of the few ways we get an opportunity to make money. And so being that we can now have it where we can see actually who we're renting from, and we can start comparing so that we know that we get the most for our buck.
Absolutely. Yes, sir.
Thank you, Mr. Lundy. Anyone else? Any questions for Ms. Holloway? Thank you, Ms. Holloway.
You're welcome.
Mm-hmm.
Thank you.
Okay, next we'll move to 4C, Dr. Petrie Martin.
So good evening to everyone, and certainly it is an honor to bring this work before the board and our community. We have had a team of individuals working on this presentation since the governor announced on February 5th his request to have all of the schools having in-person instruction by mid-March. So if you go to the next slide, I will kind of dig into the governor's exact request that he made of all of the school divisions. But at that time, he did make the request that we provide in-person learning options to students. And that is going to be a critical word for our presentation this evening, learning options. And so the governor did call on all public school divisions to make in-person learning options available, at least to some students. That is what the request was, and that's why I wanted you to actually see the announcement so we could see exactly what the request is. If you go to the next slide, we also received some communications from the Virginia Department of Ed telling us some of the essential elements of moving to this in-person instruction process, things like universal mask wearing, physical distancing, hand washing, cleaning, disinfecting, and so on. So you'll see a lot of these things weaved into our presentation this evening to get us to options for in-person. So as you go to the next slide, what are some of the rationales for today's presentation and the path that we as a leadership team have taken? First of all, it's important to note that nationally, students have had struggles during this pandemic. There's no doubt about it. The data certainly has panned out to show that our students have missed significant amounts of schooling. They've also lost a sense of routine in some cases, and inconsistency with educational modalities has also impacted our students. So as we think about offering in-person instruction, we certainly have to enhance our skills to be able to prepare for that. You'll hear that in today's presentation. If you go to the next slide, we also know there has been some learning loss. That has been a phrase used across the country during this pandemic. Even Time Magazine did an article about the impact of learning during the pandemic, whether kids were hybrid, whether they were all virtual, or attempting to go in person and then back to virtual. So there have been some concerns there. And then, of course, I always like to remind everybody with the next slide that Petersburg City Public Schools is a corrective action plan school division. And so, of course, we have to always ensure that we are complying with the Virginia Department of Education guidelines. If you go to the next slide, this is a slide that I have shown you before, that we are working so hard to ensure that vaccines are available for all of our staff. Here were the dates that we had started with. We know February 13th did not happen because of the ice storm. We're hopeful that the one scheduled for this coming Saturday will still hold true, knowing that we have some inclement weather coming in. Also, if you go to the next slide, we have paid attention to the fact that Pfizer, which is the vaccine that our staff has received, Pfizer has caused some side effects after the second dose. So as you look at our start date for in-person, you will notice we tried to mitigate for that as well, because our goal is to have everyone through the second dose by March 13th. Okay. If you go to the next slide, I always want to present COVID-19 cases so that you kind of know where we are. We typically will look at our student data. Our numbers have not shifted very much regarding cases, hospitalizations, or deaths for our student groups 0 to 9 years old or 10 to 19 years old. But I did want to share that with you. And then, of course, we're always tracking on the next slide. Are we in red consistently, or have we shifted to yellow or green? As I said during our last school board meeting, we had shifted to green in one of the categories, which is positive, but we still remain red in a couple of other categories when it comes to transmission. So with that being said, if you go to the next slide, we still have to have health considerations, protocols, and extensive planning in place for us to be able to do any type of in-person instruction. So, go to the next slide. We know that the 3 W's still hold true even after we get our vaccines, that we need to wear face coverings, we need to wash our hands, we need to wait at least 6 feet apart, and practice all of those good mitigation strategies. So the next slide is just a list of what I call disclaimers, assumptions, and clarifications. We know that we can only lower risk during this COVID-19 period, right? We talked about this back in July. We can't remove all risk, but we can certainly attempt to lower them. We all need to exhibit patience and grace during this transition. That's a word that I personally have used a lot, grace. Also, yes, we had planned to continue PVA for all students to at least April 1st, but now we have to adjust that because of the governor's charge that was given to us February 5th. Again, vaccines are being made available to all staff, and the goal is to have the second dosages completed by March 13th. And we also have to consider, as we roll out this proposal, that our older students should be able to continue doing virtual learning for a longer period of time. So these are all kind of disclaimers and clarifications before we get into the meat of the presentation. So when you go to the next slide, I do have the key decisions that we really need to focus on this evening. The first is offering family options to stay within the Petersburg Virtual Academy or to select in-person instruction. Okay, so giving our families options, and the survey data will show you why we're going in this direction. And then we're looking at a phased-in approach for any students who do select in-person instruction. We know the governor's priority for in-person instruction has been the youngest learners, so the pre-K, first, second, and third. So you will see us considering that in our first phase-in as well. And then the second phase-in, again, is considering that possibly by then, the community transmission rates will have decreased. So these are all things that we thought about as we put forth this proposal. So what did our families tell us? So let's go to the next slide. And you can, there we go. So one of the questions we asked our families, and we had 1,566 responses, which is actually the highest response rate for a survey since I've been in the city of Petersburg. And in this survey, we asked, for reopening schools to in-person instruction, which option do you prefer? 73.6, almost 74% said they want to continue the PVA. And then we had about 26.4 who said they would prefer more of a hybrid model where kids were coming back into the building. So again, this informed our decision to offer some options. Okay. If you go to the next slide, we always ask the question, which issue is your biggest concern with returning to in-person? And you can see almost 54% said it's community transmission is their biggest issue with COVID-19. If you go to the next slide, we also put a survey out there for our students because we wanted to hear what our students were thinking. And we had almost 400 students respond. But as you can tell, the students at 56% do want to come back to school. And that is something we had heard from other school divisions as well. But if you ask the students as well, what is your biggest concern, which is on the next slide, you will see our students are also concerned with transmission of COVID-19 as their biggest concern. So we also surveyed our staff. So if you go to the next slide, you will see that we asked the question, when as directed by Governor Northam, PCPS returns to some form of in-person instruction, do you plan to return? We had 87.3% of those who took the survey say yes, and about 12.7% who said no. And of course, they did share personal pre-existing conditions that could be a barrier, or having family members with pre-existing conditions as well. And just as we asked our staff, our families, and our students, we wanted to know what was their biggest concern with coming back. So if you go to the next slide, and it's no surprise, it was community transmission of COVID-19. So this is just some of the survey data that we pulled to kind of get a sense of where our community was at the time that the governor made his request. So now we're going to dig into the nitty-gritty of the presentation. Hopefully I've set the tone enough for us to talk about the instructional phase-in for doing both in-person and PVA as options to our families. So at this time, I'm going to turn it over to Dr. Daniels, our Chief Academic Officer, and she will take us through that portion of the presentation, unless you have a question for me.
Excuse me, Mr. Miles. No, we agreed that we would not ask questions to after presentations.
Oh, sorry.
No, she hasn't.
Sorry.
This whole entire presentation is hers.
Oh, you want everybody to present?
Yes.
Okay.
Because she's going to come back, trust me.
Okay.
Okay. Dr. Daniels can proceed. Dr. Daniels?
Thank you, Dr. Petrie Martin. Good afternoon, Chair Pritchett, Vice Chair Pierce, School board and community. We are going to present to you the recommended instructional phases and options for reopening schools for in-person instruction. Next slide. So as we begin, we want you to know that we have two slides that look similar, but both have different start dates. So let's talk about the phases. We have two phases. The first phase begins on March 17th. The first phase offers two options, option A and option B. Option A, students are in school for 4 days and at home on Fridays for Student Support Day. Option B is the Petersburg Virtual Academy, and students are at home online 4 days a week with Friday as a student support day. This option or phase is for pre-K through 5th grade students only, and the start date would be March 17th. Next slide. Phase 2 offers the same two options for families and students to choose, but it is only for 6th through 12th grade students beginning April 12th. So we will have our several weeks before we are opening phase 2. Phase 2 would be the Monday after spring break. And this option would be for 6th through 12th grade students who choose in-person learning would be A, and at home or PVA would be option B. So we're offering the same two options in two phases, but for different groups. Next slide. Again, option A, phase 1, will begin March 17th. Okay, students that are at Westview, our preschool students, or our K through 5 students at all elementary schools will have the option to choose in-person learning. So this would be an option to choose in-person learning or PVA. Next slide. Phase 2, option A, in-person learning, would be offered to students at Vernon Johns Middle School, Blandford, and Petersburg High School, grades 6 through 12. So they would have the opportunity to choose if they want to return on April 12th or remain in the Petersburg Virtual Academy. Next slide. Okay, so all option Bs for both phases our students would choose to remain at the Petersburg Virtual Academy, what we call PVA. So option B in both phases is PVA. So I want to reiterate that we have two phases and two options. Next slide. Okay, to prepare for in-person learning, we know we need to have time for teacher preparation as well as student preparation. So we're calling these days transition days. So we are stating that we want to open school for our preschool through 5th grade students that choose the option to return on March 17th. And so here are some information that is instrumental to the opening of school on March 17th. March 15th and 16th will be considered division-wide asynchronous learning days. That is a Monday and a Tuesday. School would start on Wednesday. And on that Monday and Tuesday, students would learn at home. All students would learn at home. Even if they chose the in-person option, they would learn at home those 2 days asynchronously, meaning they won't have the teacher, they won't be dialing in, they will be working through our LMS, which is Schoology, independently on March 15th and 16th. Okay, students will not Zoom into classes with their teachers, but are expected to complete all assignments provided by their teacher. And teachers have ways to check to ensure that was done through Schoology. Next slide. Okay. On March 16th, which is the Tuesday before the in-person instruction begins, we're calling that Transition Day with Your Teacher or Meet Your Teacher for all students choosing the in-person learning at school or those choosing to remain in the virtual academy. Both groups would have this day to meet their teacher, to ask questions or discuss whatever concerns there may be. That's the day with their teacher, just like we would have in August before school returns. And so we will ensure that Zoom links and information will be provided in a timely manner to parents and students for that day. So we're calling that our transition day with the teacher for both groups. Next slide. Okay, now for our April 12th phase, again, this is our secondary group of students who choose the option to return in person and those who choose the option to remain in PVA. April 1st will be a division-wide asynchronous learning day. So April 1st will be a day where students would work independently through Schoology. April 2nd, coincidentally, is a student and staff holiday on our current calendar. So our students would be at home learning independently on the Thursday, and then they would have the Friday off. All students, whether PVA or in person, would work independently. Assignments are located in our LMS, which is Schoology. Students would not Zoom in that day. And in-person learners would not come to school on April 1st, but would be required to work at home. Now that next week is spring break, April 5th through 9th. So we are preparing for the new cohort of students who opted for in-person learning or PVA. We're planning for the second phase to begin before spring break. Then after spring break, April 12th would be the day it actually starts. Next slide. Okay. So again, that day, April 1st, is what we indicated, would be the transition day with the teacher. So both phases have these days embedded in our planning so that parents and students would be able to transition smoothly, whether they're in person or remaining in PVA. This is our secondary cohort. Next slide. Okay, so we thought it was important to share some additional student information. Students returning to in-person learning will keep their issued materials at home, such as their flying classroom kits that they were issued, their workbooks, their supplies. There are many things that have been picked up at the school. They would keep those items at home. Now, students returning to in-person learning, if they choose that option, regardless of the phase or cohort, they would be required to bring their Petersburg City Public Schools issued laptops with them to school each day. So that is something they would need to bring with them when they come to school. And we will have a day at the end of the school year where they can turn in those laptops that were issued. And that would be for everyone that was issued a laptop would be made aware of that day. Next slide. Okay. All right. So now we've talked about what the transition days look like for students and important information for students. Now let's talk through what that means for our staff. So the first phase, or the March 17th reopening for in-person instruction in PVA, all staff, March 15th is again that Monday. All Petersburg City Public Schools teachers would return to school for a review of protocols and mitigation procedures with principals. They will have the opportunity to sit down with their principal, who will go through protocols for entering and exiting the building and to ensure safety while they are in the building teaching. Teachers will be required to work their 7-hour day, 4 days a week in the building, and Fridays would be a student support day for teachers at home. Instruction will remain the 5.5 hours as it currently is for both our virtual learners and our in-person learners. Again, 4 days a week with Fridays as our student support days. So Fridays will be the same as it currently is right now. Okay, all teachers, our preschool through 12th grade teachers, will return to their classrooms, whether they are teaching in-person learners or whether they are teaching in the virtual academy. They will do so from their classroom. Teachers will continue to have meetings, faculty meetings, staff meetings, committee meetings using Zoom as we currently are right now. Next slide. Okay. Student rosters will be provided to our teachers who will teach students that return to school. So that would be that Monday, if not before. Student rosters will be provided to our teachers. Our pre-K through 5th grade teachers will be responsible for contacting parents regarding changes, if any, to teacher assignments. Room arrangements may occur during this time. Our Petersburg Virtual Academy teachers and in-person teaching will occur again in classrooms and not at home. Teachers will use this time for planning and classroom preparation. So in preparation for the March 17th reopening, this would occur on the 15th and or the 16th. Next slide. Okay. Again, the transition day with your teacher for all students choosing in-person learning at school or those choosing to remain in PVA, as we said earlier. And of course, let me reiterate that if a student chooses to remain in PVA, their transition day will be virtual. So they will not have to come in. Their transition day will be virtual, as we had in the fall when we started school in September. Next slide. Okay. Now, our second phase, our secondary students and teachers. So now let's talk about what this will look like for our teachers. As we stated earlier, that transition day would be April 1st. And so same as the elementary teachers, that is a day for students to meet the teacher, either in person or online, depending on the option that is chosen. Next slide. Okay, and some additional staff information that is important to be aware of. For our second phase reopening, which begins April 12th, our secondary staff, because we have some courses that are only taught by one individual, we may have dual roles included in those learning environments where teachers may teach virtual students and in-person students simultaneously. I want to reiterate that we do have the technology tools to ensure that this occurs effectively, and we will ensure that all teachers that may do this will be trained appropriately. Principals would need to meet with staff during the week of February 22nd, and that would be all staff, to determine who will teach in PVA and who will teach students that choose the option to return to school. All teachers will be in their classrooms teaching beginning March 17th. Next slide. Okay, we will make special considerations for resource classes, art, music, library, PE. We understand that safety is a priority. We can't have students sharing art supplies, so we won't have that. We won't have dressing out for PE. The media centers will be closed, STEM labs will be closed, so all of these things have been considered. Next slide. Okay. So we will have what we are calling a return to in-person instruction PVA commitment registration process. So this process will begin on February 22nd. Once a selection is made, it will stand for the remainder of the school calendar year, meaning if you choose in-person, it will stand as in-person. If you choose PVA, it will stand as PVA for the remainder of the calendar year. The last day of school for in-person and PVA is June 18th, which is indicated on our current calendar. And we want to reiterate that our ESL families have the option to seek support from our LEAP Welcome Center to provide guidance if needed. Next slide. Okay, so in summary, in-person instruction will open March 17th for pre-K through 5th grade students who choose the in-person learning option. PVA online learning will continue for students who select to continue with the virtual learning option. Students in grades 6 through 12 will have the option to return to in-person learning on April 12th. Per the Virginia Department of Education, all students in testing grades 3 through 12, are required to return to school for state testing in May or earlier for some secondary assessments. These tests must be taken in person at all schools. So regardless of what option, we will still need to bring students in for the testing that is required by the state. Once an option is selected, the student will remain enrolled in that option until the end of the school calendar year. All school staff will return in person to their assigned schools on March 15th. And the return to in-person instruction or PVA commitment registration process will be held from February 22nd through 26th. Okay. Next slide. Okay, and next slide. So we want to just talk a minute about, I guess, our calendar. And so here we have our curriculum and pacing guides. If there was a question about instruction and how it would be delivered in person versus virtually, our pacing guides were created to support both platforms. And so students in school or at home would receive the same content at the same pacing, okay? Our school division calendar will also remain the same, with the last day of school being June 18th for all students. Our class schedules will also remain the same. However, start times for in-person learning may vary, and we'll talk about that in a moment. Our PVA will begin and end at the same time as the in-person instruction occurring at the particular school. Next slide. Okay. So the in-person instructional day for reopening March 17th, the times are all zigzaggy here. Sorry about that. But Walnut Hill will begin at 8:30 and end at 2. Cool Spring and Pleasance Lane will also do the same. The PVA for those schools will start at 8:30 and end at 2 as well. Our Lakemont and Westview schools will start a little later at 9:15. And this is due to transportation. And so their PVA will begin at 9:15 to 2:45. So the PVA and the in-person instruction will be at the same times as the instructional date for the in-person learners. So parents will be able to choose during that commitment registration, they'll be able to choose whether they're going to drop off their child at the school and pick their child up, or if they will choose bus transportation. Okay. And we hope to have schedules available in early March. Next slide. Okay. The next couple of slides, I just wanted to share quickly. This is the elementary schedule as it stands now. And we know there might be some variations at the elementary schools based on specific needs. And so I wanted to share this just to ease everyone's mind that The school day will generally be the same. We know for in-person learners, we're going to have to add more breaks for hand washing and that sort of thing. We know that we'll need to add recess times, and resource will be done or handled a little differently than it has been in the past, but generally the schedules will remain the same. So they will get all of the core content that they are currently getting in the elementary grades, whether they are in the virtual academy or whether they are in school in person. Next slide. Same for the middle school. This is the Vernon John schedule as it stands now. And so our in-person learners in phase 2, which would begin April 12th, would follow generally the same schedule, again, with some tweaks because we know we have to make them for our in-person learners. And then the next slide shows our Petersburg High School schedule, which they have courses that are 65 minutes each. And so we would also tweak those times as well to ensure that safety protocols are handled appropriately. And so that ends my portion of the presentation, Dr. Petrie Martin.
So if it is okay, Chair, we would like to move to the operations and maintenance portion, because some of the questions that I see that have come up in the chat would certainly address Dr. Mayo's presentation. So Dr. Mayo.
Thank you, Dr. Petrie Martin. Good evening, Chairman Pritchard, Vice Chairman Pierce, members of the school board, Madam Superintendent, and members of the community. The Division of Operations has been working feverishly since the inception of the pandemic from last March of 2020. I would like to personally thank the leadership and guidance that has been portrayed in our operational crew, Mr. Lawrence, Ms. Alvarez, Dr. Sears, Ms. Holloway, Ms. Stokes, and Mr. Spencer. Next slide, please. Air quality has been a topic of concern in many school districts, and Petersburg has been following guidance from the CDC and our HVAC vendor regarding mitigation strategies to limit the exposure to viruses and bacteria. While we can ensure mitigation strategies are in place, the measures such as hand washing, social distancing, and wearing facial masks and cleaning surfaces frequently are paramount in limiting the exposure to numerous viruses and bacteria. Next slide, please. Implementation measures to improve air quality include the following: increased outdoor air ventilation with the opening of windows when possible, as well as dampers eliminating air from recirculating. Increasing the frequency of changing of air filters in all of our buildings. All classrooms and office spaces have been fitted with certified air cleaning devices with true HEPA filters to help block the viruses and bacteria in the air. And we're also utilizing ultraviolet light in our classrooms, which you'll be hearing a little bit more about in the next few slides. Next slide, please. Our ultraviolet lights are hospital grade that destroy and or inactivate bacteria and viruses by disrupting the molecular bonds of their DNA and RNA. This prevents the viruses from reproducing or causing illnesses. The units that we have purchased, they can actually disinfect the classroom in roughly 5 to 7 minutes. Each of our buildings, including our school board office, we have purchased a unit that can be utilized. And you'll be able to see in a couple slides soon, just with it actually working in an actual classroom. Next slide, please. As far as cleaning and disinfecting, we will continue to follow CDC guidelines and stress the importance of routine cleaning with soap and water. All disinfecting and cleaning supplies meet EPA standards as well as they are recommended for killing viruses and bacteria. Our custodial staff will continue to frequently clean surfaces that are handled throughout the school day, such as doorknobs, restrooms, and countertops. We will continue to use equipment such as electrostatic sprayers to disinfect rooms and other office areas, as well as the utilization of the UV lights that I mentioned on the previous slide. It is important for school-based staff to note concerns with building cleanliness to the appropriate administrator within their building in the event buildings are not up to par to staff members' standards. Next slide, please. While we're constantly replenishing our PPE inventory, this slide notes the number of items we have on hand at this particular time. Next slide, please. And as you can see here, this is just a picture showing first picture of the UV light actually in one of our classrooms. Electrostatic sprayer being utilized in one of our labs, and then just some pictures of some of the equipment, some of the PPE that we have stored at the Pittman building as well as our warehouse. Next slide, please. As for classrooms, principals will share guidance provided by the CDC regarding classroom configurations to teachers. Some of the areas that are highlighted would be desk placement, and we will be looking at the 6 feet apart option, sitting only on one side of the table and making sure students are spaced apart, marking walking paths throughout the building, hand sanitizing stations throughout the school as well as in the classroom, utilization of physical barriers, and the next four slides will highlight actual classrooms wherein some of that has already taken place, and that will be something that will be done when staff members come back early to kind of make sure that their rooms are configured appropriately before kids come back on March 17th. Next slide, please. So this is a kindergarten classroom, pretty much following some of the CDC standards as far as with spacing of students. Next slide. It's a first grade classroom. Next slide. And this is a secondary classroom. Instead of seeing those paper barriers that you see on the desk, we will actually have plexiglass barriers, and we actually have 5,000 of those actually on hand. So we have enough for every single classroom. Next slide. This is just another picture showing some of the markings within the buildings. Next slide. As for school nutrition, menu entree choices will be limited to one hot and one cold entree. The Department of Education is strongly suggesting that we serve lunches and give students the opportunity to for some type of choice. Classes will be staggered to limit the number of students in the line at any one time. So a lot of this information on this particular slide will be worked out with the principals, and they'll be kind of tailoring it to their site to make it more specific for their site. Social distancing will definitely be in place. In the event students are eating in the cafeteria, we would also be practicing social distancing. In most cases, they may be going back to their classrooms to eat their lunches. Next slide, please. And as far as getting our meals out to students, right now we actually have neighborhood deliveries that are going on, which we've had in place for quite some time. Due to the fact that we will have to be transporting students to and from school, that will not be an option after March 15th, or before March 15th, I should say. The week of March 8th will be the last week of actual neighborhood deliveries of our meals, simply because of the not having enough buses and not having enough cafeteria workers in order to have a setup of delivering meals as well as actually having meals in place at the school. So as a result of that, all pickup locations for meals will take place at all of our schools with the exception of Blandford Academy. And students who are in the face-to-face learning environment will be able to, as I mentioned, either eat in the classroom or in the cafeteria, and they will be provided their snack and their dinner prior to leaving school. On Fridays, those same face-to-face learners will pick up, just like the virtual learners are having to pick up on Tuesdays and Fridays. They will have to pick up their meals on Fridays from schools along with those virtual learners. Next slide, please. Next slide. The Office of Transportation has been transporting students since the beginning of the school year on a small scale. With moving from completely virtual to students having an option, we're asking parents to transport students to and from school. However, in the event that this is not possible, students will be socially distanced on the bus with either using the 3 feet or 6 feet option, and we're more or less leaning toward the 6 feet option, which can allow anywhere from 13 to 25 students on the bus at any given time. We will also be conducting temperature checks prior to students getting on the school bus, and drivers will be issued electrostatic sprayers along with other cleaning supplies to disinfect buses between runs. As noted, we are asking parents to bring children to school, and if not possible, at least accompany their children to the bus stops and return children home in the event the child actually has a fever. If a parent is not at the stop and a child has a fever, we will make every attempt to isolate the child on the bus, and the child will be sent directly to the isolation room, which you'll hear more about later in the presentation, wherein multiple attempts will continue to be made to reach parents. Next slide, please. This is a picture showing the 6 feet on the bus, leaving 1 seat open behind the driver. So as you can see with the red dots, that equates to 13 passengers on a bus. Next slide, please. This would be using the 3 feet model with being able to get 25 students on a bus. And of course, as we all know, the guidance that is coming out from CDC, other sources, is ever so changing, and it's more conversation around the 6 feet model versus 3 feet model. Next slide, please. And this is one of our actual buses, and this is how the buses look with the 13 students using the 6 feet separation option. As you can see, we have the signage for seats that should not be used, and those actual seats are lifted up, so no one can actually sit in that particular seat. Next slide, please. With the change of having students with options of returning to the schoolhouse for learning, all employees will be required to report back to work in person. Employees have been afforded the option of receiving vaccinations, and the following policies and regulations will be enforced regarding staff attendance, professional staff leaves and absences, family and medical leave, and also leave without pay. And this is information that will be in more detail to all employees with a return to work or return to in-person working conditions guidance document that we sent out back in August. We'll be making some revisions to that document and sending it back out to our staff members. Next slide, please. Okay. On this slide, this is just giving you a little bit more information on family medical leave. And not every single employee is actually eligible for family medical leave. It's job protection for up to 12 weeks within a rolling 12-month period. And that's an option for some employees, as well as ADA could be into effect as well, as far as making some type of reasonable accommodations. However, any type of approval for any type of leave would have to go through the Department of Human Resources, and all employees would be expected to report back to work until any types of approval are granted, in the event an approval is granted for any type of work accommodation and or unpaid leave. And that concludes the operational portion of this presentation.
So, Chair, if it's okay, we're going to continue with the presentation. We have supports for students and families, and Ms. Pam Bell will lead this, but I think she will have other staff joining as well.
Good evening, Chair Pritchett, Vice Chair Pierce, school board members, and Madam Superintendent. In this section, we will be talking about the various supports that we have for our students as well as our families. And there's a list of our staff members whose input has been very critical in this work. Next slide, please. As we begin, we will start with discussing our students and staff health and emotional well-being, which we know is a very critical topic. And to lead us off this afternoon, we will have our supervisor of nursing, Nurse Robin Cox, who will first talk about health considerations. Next slide.
Good evening, Chairman Pritchett, Vice Chairman Pierce, Superintendent and community. It gives me great pleasure to be your COVID-19 leader in the district. And so I will share with you a few slides that will kind of answer some questions about how we're going to keep our staff and our students safe when we return back to in-person learning. So as we move towards reopening our schools, we will be using guiding principles from the Centers of Disease Control, the CDC, which include preparing for when someone has COVID-19, making sure our students, teachers, staff, and families know when to stay home, especially if they're exhibiting symptoms. We're also preparing to isolate and transport students who develop symptoms while at school, making sure that we are cleaning and disinfecting frequently, and of course, notifying our health officials and making sure we also notify our close contacts. Next slide. Here, I shared with you back in August these considerations for maintaining safety and good physical well-being. This is a list of these considerations, but there are 8 considerations that I'd like to highlight, and those are COVID-19 infection control measures such as cleaning and disinfecting, hygiene practices such as hand washing, ensuring social and physical distancing, making sure we use that 6 feet standard, encouraging preventive measures such as wearing masks at all times, preparing, triaging, and monitoring for symptoms and fever. And also, we're going to prepare sick space or isolation rooms for times when we discover someone is exhibiting symptoms of COVID-19. We're also going to be doing symptoms and temperature checks, and we're going to be preparing ourselves for outbreaks. As it's been mentioned before, we cannot just cancel out any type of risk, but we can use as many of the mitigation strategies as possible to decrease the spread of COVID-19. Next slide. And so essential elements of safe school in-person instruction, it includes mitigation strategies to reduce the transmission. So regardless of the level of community transmission, all schools should use and layer mitigation strategies. And I will explain to you in other slides what that means. Use and layer mitigation strategies. There are 5 key mitigation strategies essential to safe delivery of in-person instruction, and we will use those to help mitigate COVID-19 transmission in our schools. So schools providing in-person instruction should prioritize 2 mitigation strategies, and they are universal and correct use of masks, which means we must make mask wearing a requirement. We also have to make sure at all times we are physical distancing at least 6 feet or more. And so how are we going to do that? Next slide. Mitigation strategies take extra effort, takes extra time. So therefore, implementation warrants additional employees. Additional staff will help with these symptom screenings and enforcing mask wearing and physical distancing. So strategies for keeping everyone safe include recruiting and hiring additional staff. Next slide. This is an illustration of how important it is for all the mitigation strategies included in our plan must work together. This is what I mean by layering the mitigation strategies. Take notice here. Minimizing the spread of COVID-19 infection would take everyone's effort to do their part. And this pandemic requires multiple layers of protection to keep our schools safe. So look at the illustration here, like Swiss cheese in the picture. Each layer has holes in it, but when the layers are put together, or every mitigation strategy is used together consistently and collectively, the holes will be counterbalanced by the strengths of another layer of intervention. So we plan to implement all the layers that we can to minimize the spread of this disease. Again, I say we plan to implement all the layers. Next slide. Which this slide tells you there are additional layers. So we plan to implement all the layers that we possibly can to minimize the spread of this disease, which include physical distancing, hand hygiene, ventilation, quarantine, mask, testing, and of course, now we have vaccines. Next slide. So our plan is to stay in constant connection with the sources and resources that we have at hand. We plan to stay in constant connection with the health department, our Cradle Health District, and we're going to use the guidance documents from the Virginia Department of Education. These documents include information taken directly from CDC, Virginia Department of Health, and the Virginia Department of Education. And these are listed, and there are also links. If you want to, you can click those on. I'm not going to click them on and go through each one, but these are the sources I wanted to share with you that we are using to guide our decisions. Next slide. This slide basically just illustrates a flow chart that we will be using in case a student exhibits symptoms of any type of infectious illness in our school, because we have to, if they exhibit any symptoms, we have to be cautious as if they are COVID-19 symptoms. And this is just a flow chart that we will be used, which everybody will use, so that we'll be on the same page. And this flow chart comes directly from CDC. Next slide. So everybody's question may be, what happens if a student or students or staff get sick? The first thing we need to do is separate them. We have to separate them from everybody else, which means we have to isolate them and arrange for safe transportation away from the school. We have to make sure we're cleaning and disinfecting that area. We have to notify health officials immediately for reporting and to get guidance from the health department. We also have to communicate with our staff and families who may be affected by this new case or this sickness that's in the building. Affected students, parents, and staff must consult a healthcare provider if they are designated as someone who has to go into isolation because of sickness. Students and staff can only return to our buildings after being cleared by a healthcare provider. And we put that in place to keep everybody safe. Next slide. Again, what happens if students or staff get sick? isolation, quarantine, and identifying close contacts. One of the more important steps is communication. We have to let everybody know what's going on. We have to be very transparent, and we also have to make sure we're letting our staff, students, and families know if we have a case of COVID-19 in the building. And so we have talking points already prepared for if someone comes down with COVID-19 in our building. We have talking points that we are going to share with our families. Next slide. This is a picture of some of our isolation rooms that we have set up already in our schools. So we did receive some funding from CARES Fund, and we received our supplies that we ordered, and we have set up our isolation rooms in our schools so that we can be fully prepared for cases that we identify in the schools. Next slide. This is a tool that schools can use that comes, and it's a link. It comes directly from CDC, and it has actually checkoff boxes. And a school can use this, or a school division can use this tool to make sure we're fully prepared for in-person learning. So what we're going to do, and we have been using this tool since July or August, but we're going to use this tool again to make sure that we're not only ready for in-person learning, but that we stay ready for in-person learning. And I think that it concludes my portion of the presentation.
Great. Thank you so much, Nurse Cox. We appreciate that. So not only is the physical health of our students and staff very important, but also the social and emotional well-being of our students. As you'll see on this slide, we were very fortunate with the support of our school board and our superintendent and our team to purchase a curriculum last spring. And we actually moved in this direction before we left for the pandemic because we recognized that our students needed that type of support. As young people, they're going through various things. And so this curriculum helps them to be able to identify how to self-manage, how to encourage empathy, how to make good decisions. And so this curriculum is being taught to them each week through various modules and training, and our staff have been thoroughly changed. And honestly, we need this even more as we continue. Next slide, please. So in order to support our students and our staff, some of the things that we are considering. So of course, as we've mentioned here, the support for our students. We are continuing with the Rethink curriculum, which is being taught to them, and those are for students in grades 2 through 12. And also we have a curriculum for our preschool students called Quaver. So the programs are very child-centered, very engaging activities, things that help them to understand. So we will continue with that this spring as well. And we're very excited also when we have our transition days to be able to provide additional support for our students by presenting them with calming kits. And in those kits, we have various journals, Rubik's Cubes, different things that help students with coping, and just to be able to keep them calm, and just some activities because we know that they're going through quite a bit. And with our staff also, we're supporting their social emotional needs as well. Our social emotional team has provided various self-care sessions. Just in March alone, they're conducting about 25 of those sessions to continue to support our staff in small groups. We've continued with our Wellness Wednesdays, and that will ensue throughout the rest of the year. We've also offering our staff support through our employee assistance program. We've had them to actually log on with us and provide intimate sessions with our staff to support them. And we'll also look at different fitness options, which our Superintendent's Advisory Committee, they have been awesome and have provided those suggestions and guidelines as well. Next slide, please. So the data that our students have shown us proves that we're in the right direction. So this slide just shows that we had about 1,300 students who completed an SEL student self-assessment. And this chart tells us that our children have said that they have scored themselves low or very low in their overall social emotional learning. And so with that, we are being intentional about the lessons in the classrooms. We're being very intentional about identifying how do we help them, and we'll continue to do that whether they are in person or through the PVA. And self-management was one of the areas that they scored the lowest. Next slide, please. So at this time, we'll go through and we'll talk a little bit more about what are we doing to support our students in various ways, and also family support. Next slide. So with our special education students, and so many of these are the things we've talked about, and our special education team has been phenomenal. They've continued to provide the specially designed instruction, provided various aids to support our students to make sure that we're following their IEP goals. They will continue with related services for OT and PT, and those will be through tele as well as in person. Virtual learning through, and also child find process. We will continue that virtually as well as through in person, especially with our kindergarten registration period coming up soon. Our case managers will continue, whether virtual or in person, to work with our staff, our students, making those contacts bi-weekly with their parents, and continue with the solid instruction through co-taught lessons, small group lessons, one-to-one. And we're very excited also that our special education advisory, we've been working very closely with them. And we do invite parents. We want to recruit more parents to be a part of that. So if you're a parent of a student with a disability, please join them as we work through, and they're helping to provide support and advisement in that area. And the next public meeting is May 16th. Next slide. For our students who are non-English speaking students, we'll continue with them as well. Our LEAP program. In our LEAP program, the same as well. They have been doing a great job with translation. We recognize that we want all of our families to be able to receive the same information, but certainly in the language that they speak. And so our LEAP team has done a great job with that through robocalls and revising flyers and information. The teachers will continue to provide that one-on-one support as well as co-teaching, push in and pull out models. Our students are having access to all materials, various materials that are at home. And we've been very excited to have our English language learners families joining us for our Parent Connect Ed sessions, which is our platform in which we invite all parents to join us. We have various topics every month, every other Tuesday at 5:30, and those will continue. And we'll be also offering morning sessions starting the March and April sessions. So we do ask you that you join us. And one thing that's new is that we're offering a free ESL class for parents. And so our parents have asked about, they want to have a class in English. And so we have moved in that direction, and also offering Spanish classes for our staff. Next slide, please. Student attendance. Our babies cannot learn if we don't have them. We just want to make sure that whether we're in our virtual environment or in person, our students must attend. We need our students logging on and staying on throughout the day to gain all the knowledge that they can. And when our students return to in-person, we want to reiterate with them again and with our parents, on-time attendance, all-day attendance is critical. So we are asking everyone who's out there hearing the importance of our students being present so that we can teach them. And so attendance will continue to be taken, and those guidelines will be reviewed. And as parents come to the schools for those transition days, additional information will be provided with them once again. Next slide, please. We will also make sure that our students, we will take time to review the student code of conduct. Our students have done very well in our virtual learning, very few situations, and we do know that the same will occur when they return to us in person as well. So we'll review those guidelines with them. Principals and teachers will definitely be resetting classrooms virtually, resetting classrooms in person, and making sure that all of our students come back serious and ready to go, but also understand the expectations for Petersburg City Public Schools students. Next slide, please. And how will we continue to communicate with our families? And so there's a lot of information here, but in a nutshell, we have continued to make sure that communication is key. And we have done all that we can do, and we will continue to find other creative ways to make sure we reach our parents through various mediums, through robocalls, text messaging. We want to make sure that our parents know upon return also, we will continue to provide support to you. If there are parents who need help, the student support specialists that are assigned at each school stand ready with resources and information to support them. They're the liaison for them, and they will work very closely with our Title I teams to make sure there are various engagement events for academics as well as social, emotional, etc. And with Parent Connected, we've talked about that. Just please look for the flyer. Every 2 months, that one will come out with various topics that interest parents. And if you have suggestions for topics, let us know. And even though we have those sessions that we have a specific topic, we always allow time at the end. Our superintendent, our chair of our board are always there. It's a great time for us to have conversation with parents to address questions and concerns and ideas. And that has really been phenomenal. We're excited about our Division Parent Advisory Committee. They have been just boots on the ground, and you've been seeing information from them. They've really been an advocate for all that we're doing to support our families during this transition. We have book drives going on right now. We have a toiletry drive going on right now, so that on February 27th, anyone who needs toiletry items to get back into the swing of things, whether you're coming back to school or if you need them at home. And they're also, tomorrow, we have a walk it out session. So although it's supposed to be icy, we're saying walk wherever you are. It's all about us getting together as a community and a family to do things together. We're not letting any excuses get in our way, academically or otherwise. And so there are various resources. If you need food, clothing, what have you, please contact your student support specialist, your school principal. We're here to help you in any way that we can. Next slide, please. We do want to remind our families that some critical things. So school requirements, this is not just now, but this has been since September and it's every year. It is a requirement by state law that all students must have vaccinations and physicals up to date every year. This year, in light of COVID, there were some extensions of time to get those. However, we do need you to see here, elementary and then 7th grade students, you are required to have their TDAP. So students will not be able to return to in-person learning if these requirements have not been met. So we have listed here just different options. So we're asking parents to please make sure that you seek your private physician, the Crater Health Department, or the Crimson Clinic, which is housed at Petersburg High School. And what a great resource for us. So our city transportation is free of charge for anyone who wants to ride to get to those locations. And they have worked very closely with us to make sure that there shouldn't be any reason that any parent does not have transportation. We're here to partner with everyone. And please make sure your contact information is up to date. So that is something we're going to be pushing because it's just very critical for safety reasons. Next slide, please. And in closing, it's just, we're just really ready to celebrate again. You know, we will have some students who will remain in PVA and we'll continue to love up on them and support them and do all the great things we've done all year. And then we'll also be ready to transition with students who choose to return to virtual learning if that is approved. And those transition days have been stated by Dr. Daniels earlier. There will be individual school events, so please listen to those announcements that will be coming from your principal. We'll be sending some of that information via social media. And then to help each and every one of you, all of these things will be provided during those times. So code of conduct, student handbook, school supplies and book bags. It is back to school time. We're transitioning. Whoever needs those resources, we have them for you. We're just excited to continue PVA, and we're excited to have students to return to in-person learning. And last slide, please. And as we close out, ideally, we're just here. We're just trying to keep our students and families informed, provide them with the support that they need. And all of this is what drives us as a school division. That concludes my presentation.
Okay.
Since Chair, that concludes the formal presentation. And so we'll turn it back over to you, Chair Pritchard.
Thank you, Dr. Petrie Martin. I want to thank you and your staff for all of that wealthy information that you all have given us. At this time, I will ask board members if you have questions. Mr. Miles, you were first.
Okay, my first question is for Dr. Petrie Martin. During the survey, did we get any write-in concerns that wasn't on the survey from anyone concerning in-person learning?
Yes, so we absolutely have parents who said they would not send their children back for in-person learning because of the concern with COVID transmission in the community. And then, can you hear me?
I can hear you, but I was thinking of, is it anything that you received that wasn't presented, that was on the survey that might be of some concern of a parent? Did they write in anything?
Well, we had hundreds and hundreds of narrative information and
Right.
full honesty. So, of course, I wasn't going to present all of that this evening, but it always fell in the categories that we listed. And the bulk of it was in that
Okay.
COVID transmission and just concerns about how do you mitigate for that at this time, whether
Right.
it's keeping masks on children, whether it's cleanliness. So that was the big bucket of that
Okay.
narrative part.
So basically, they were concerned with the things, how we going to implement it.
Correct. Yes, sir.
Okay. I have one question but two questions for Dr. Daniels.
Okay.
Okay. The schedule, the in-person schedule, not the virtual. Okay. How will the new in-person schedule benefit/improve COVID-19 exposure for teachers, students during the learning and teachers during the learning time? How would that schedule help out? And
Sure, great question. So one of the things that we know, we will not be able to solidify our elementary schedules for phase 1 until we get everyone registered, because that will determine, for example, the amount of students in a class, the arrangement of the classroom, and that sort of thing. Once we find out how many students are returning, then our schedules will definitely be safety first, meaning we're going to have breaks in our schedules for students to, wash their hands. We know it will take longer for students to transition. And as was explained, all of those markers and things like that are already in the school, directional signs and all of that. But we will have our staff arrange their classroom based on the amount of students that are there. And we are thinking right now, they will probably be small class sizes.
Right.
So the schedule will include breaks and safety measures for transitioning. Small groups won't be able to happen because we'll have to have students, 6 feet apart. So it may be a small group, but they'll be spread apart, if that makes sense. So the
yes,
way
it does. Matter of fact, you answered another question about the transition. Okay. So my last question to you, Dr. Daniels, is who would be present from the central office to observe and assist during the big startup of in school or in person?
Well, I'm not sure if you want me to answer it or Dr. Petrie Martin, but all of us will be present, Mr.
Everybody be present, okay.
Mm-hmm.
Right. And we usually assign central office staff to certain schools, but we usually take turns, so we all get through all of the schools is usually how it works out.
That right there answered another question.
Okay.
So I had one question for Dr. Mayo.
Okay.
Okay, one question for Dr. Mayo. Dr. Mayo, are you there?
And how you doing today?
How you doing today, Dr. Mayo? I want to commend you on your presentation for the operation, and Nurse Cox also. And but what I wanted to ask you was, did you or anyone reach out or consult with any local environmental experts for viruses and disease? If so, who?
No, we did not. We just relied on information we received from the CDC, and also when it comes to air quality, we just relied on that HVAC vendor we've been using.
Okay, so I'm going to ask you and Dr. Petrie Martin at a later time I would like to talk to you about that. Okay.
And I will also say that VDH, which is the state health department, we did consult with them as well.
Thank you. Very good. That's it. I have no more questions.
Thank you, Mr. Miles. Ms. Wynn, any questions? You're good. Mr. Pierce, any questions?
I don't think it's necessary a question, Mr. Chair, but I'm going to direct my comment to Mr. Mayo. And I had asked before with regards to the scheduling, because by design, I see that we've schedule the start times of each school, and I saw that in the presentation. But was that relative to the bus routes? Because I know now that how we schedule, or how by design, how the buses with the children on the buses now, you won't have 55 kids on the bus. You'll have either 15, 23, or whatever. So did that increase, or how did that increase, or by design, how did that affect your routing?
Well, right now, it's hard to determine what the routing is going to look like until we find out who actually is going to select in-person learning. So we have to also take into consideration, we would probably only be able to get 13 kids on a bus.
Gotcha.
So all those variables will come into play once we get more concrete information.
Okay.
And we'll then be able to make more sound decisions. So the scheduled time we felt comfortable with, simply because right now we have that model in place with 3 of our elementary schools on one schedule, and then of course Lakemont being on the same schedule as Westview, in a sense, being there on opposite ends of the city.
Okay, so that means that the determination of the timing of what school, although we saw those times, then that may change as well.
We're hoping it will not change, but we may have to have a little flexibility or wiggle room, because we're dealing with elementary kids, so we don't want to keep pushing back the time frame where we're picking them up out in the neighborhood, like we would do for, say, a secondary student.
Okay, that makes sense. That's all I had. Thank you, Mr. Chair.
Thank you, Mr. Pierce. Mr. Bundy?
Yes. Dr. Petrie Martin and your team, great job, because it takes a lot to do what you all are doing. One thing that we need to realize, when we started this off, and we got that first sheet from the schools, that who would be served first in the area, was the inequality and the inequity of this whole situation. We weren't looked at as being at the top when we were 132 at the bottom. And nobody came to our rescue until later. And now we're rushing to make these moves. And we don't know if we have serviced every adult that's needed in this division, which isn't our fault either, because I remember that list. And that list started from the best all the way down, but it never had poor Petersburg anywhere in there. I was wondering, this has been an important part to me because of the 2 styles that we're going to take as far as learning is concerned. What has our measuring tool been for our academic progress? Because we haven't seen that.
Right.
And with us not seeing that, the determination of what direction you need to take is very hard to see. I think you and I had a discussion one day, and I was asking you, Dr. Petrie Martin, do you think, I wasn't putting it on you, I was just saying, do you think that there is professional development that builds around a good virtual teacher? Because I believe there's some professional development out here that we may not be getting. Because we now have seniors that will be getting out of school. We have to make sure we hit the mark in providing them with the necessary training that they need to be successful as they matriculate to other educational institutions. And at this time, March 15th, being a day that has been thrown upon us, whereas the board was given the autonomy, it is really something. So somebody is going to fall behind again. This division may be that somebody. And so these considerations have to be taken if we are doing the right thing. But without having the tool to measure the academic progress, it's hard to make the determination of the direction that one would need to take. Our concern, of course, our parent concern is over COVID, But along with the COVID, the academic is involved here. And we have to make some other decisions. Just because the State Department is putting something on it, there's some other considerations. Every household is different. The number of people in households are different. The needs are different. There are different styles of learning, especially when we speak of our special needs kids, the kinesthetic, tactile, your hearing, your visual. All of those things are different. And that IEP has a lot of that in it. Have we met those challenges that they need? Those kids that need to listen to get it. Those kids that need to see to get it. So where is the tool that's going to determine the progress that has been made virtually? It's a challenge, but have we met the mark? And the mark doesn't have to be the highest mark. But where I haven't heard us say where we are through the virtual.
So I know that our board members had received the benchmarks from the first quarter, and so you absolutely saw where we were. We have just completed the second quarter benchmarks, and we will have that data available for you. We just hadn't finished it up. I will tell you, though, and I'm at liberty to say we have seen improvement. But we will be sharing that with you hopefully by Friday. But you did see the first quarter, and we hope to give you the second. But you know, Mr. Lundy, this has been a challenge for all of us because our focus definitely has been on the COVID-19 cases because we are in the red. We are 132 on health risk indicators, as you have mentioned. So we have tried to balance that with everything else. Have we done it perfectly? We know we have not, but we have worked really hard to do the best that we could. Now, February 5th, when the governor said we need to have some in-person options, what we have done with this plan is try to bring to you our best thinking about how we could make that happen, still trying to mitigate for the COVID-19 transmissions. So,
but I want you to understand what I just said. And what I was saying was not to put anybody in one category.
I understand.
What I'm saying is that because we were given this in the beginning, you cannot come around and expect for us to be doing perfect when we may need more support. That's what I'm saying. You can't just say March the 15th because you and a group of people got together and said that. But our division may need more support because we can't just, this is new to our kids, just like we said, and you all have done your best. But to push us like this, to push parents like this, and not to know what support, other support needs are really needed as we move forward, that's a hard picture to look at. And so I just wish we consider those things are considered. Dr. Daniel spoke of kids being able to be with their teachers ahead of time, and I want to commend that thought because it's going to take everybody's jumping nervous. I never knew so many kids are really concerned about the masses. I mean, young kids. And so if we have all of these fear factors, along with not really knowing whether this is working for our kids to move forward, then we've done damage because a few people got together and decided that March 15th is the day they're supposed to come back into school. This is supposed to be the face-to-face, the kids and school systems that are different. They have different situations. They have better situations. They have cities that support them financially better. They have parents that may be in better shape. All of these things are factors that we have to talk about for our kids. These are our kids. Mm-hmm. And I just want us to think about that. about our kids, because we have some smart kids,
Yes, we do.
but we put them in a different bag now. And we just shaking them up and say, this is what we're going to do with them. And we're going to kill their future academically. So I just want to bring that forward. And I'm not saying you are not doing a good job.
Yeah.
I'm saying I believe that more should be given to us so that we can help our community, our kids, and our parents. Thank you.
I like to say one thing.
Mr. Miles.
I like to say one thing.
Mr. Miles. No, sir.
I just want to reiterate one thing, and this is just very positive.
No, excuse me. You have to address the chair.
Oh, Mr. Chair. Mr. Chair, excuse me. I apologize.
Okay.
Mm-hmm. Okay. The focus of this meeting, well, what you said was very important. But the focus of this meeting is when we bring the kids back to school, are we safe? And have we put things in place? When it comes to the product is education. But we can improve on education, but we cannot replace the staff or these students. That life is so precious. So what the focus of this meeting was to make sure that we put measures in place so we give us a starting point of in-person learning. And I think they did a very good job where we're starting. The concern will be, how do we improve learning? But safety is our top priority tonight. And I think the committees and the superintendent for getting us to that point. And I'm looking forward to the start so we can see where we can improve and how we can make it better and safer for the whole environment, for the teachers, students, staff, and everyone alike. Thank you.
Thank you, Mr. Miles. Ms. Nguyen.
Sir Chair, I was going to strongly concur with Mr. Lundy. And I too understand, was going to just say something in the same reference to what Mr. Howe said. It is important that we get an assessment, and without the assessment, to make sure that the atmosphere is also a safe atmosphere with the assessment to see how strong our kids have done since they've been home.
Okay. Mr. Lundy. You're on mute.
Weren't on the board at the beginning.
Right.
But Dr. Petrie Martin and her staff, they haven't said anything different tonight than they've said from the very beginning. They've been on point as far as being concerned about the safety of this building. They put all the things in place that you need. So they are in place. But there's the other part that I'm talking about. That has to be the place. Mr. Mayo has ordered, Mr. Lawrence has cleaned, they have done everything. The only thing they've done is reiterated that which has been said continuously through the time that I've been on here, through this pandemic. It's been good, it's been the same, it's been consistent. There has not been any inconsistency in the superintendent at all. There has not been any other additions other than the machinery that we've seen in there. Those were the added things that were already in the plan. They just came to, we just got an opportunity to see them and to really know them. So the safety was already in place. That was the first thing that they dealt with. Thank you, Mr. Chair.
Thank you, Mr. Lundy. Okay, Dr. Petrie Martin, I have a few questions. Will we allow the YMCA, or have we talked to the YMCA about providing childcare for the parents that are planning to send their kids back and are going to work?
We can go back to them. We did that in the fall, and that was not an option at that time. But we can certainly go back to them.
Okay. The next question, what is the plan for substitutes? This is probably Dr. Mayo and Dr. Sears. What are our plans for substitute? What do our substitute list look like right now? And if it is low, what is the plan to increase it?
Well, Mr. Chair, we have been trying to get substitutes in place. A lot of substitutes when the school year first started, they were not interested in returning at this time. That is still a challenge. Most of our schools, they do have a permanent substitute in the building. I know at one of our schools, that permanent substitute is now actually in a classroom teaching. But we are actively recruiting. We've had a virtual job fair this week, and we actually have 3 candidates, 2 of them being candidates that can actually start right away, coming from out of state. So we'll be able to kind of take a look at it in that light, but we are still struggling like everyone else to find substitutes who are willing to come in to work during this time period.
Okay. So if a teacher, another question, if a teacher who's teaching virtually and that teacher has symptoms and cannot come into the building, will that teacher still be allowed to teach, or will you have to get a sub?
That would depend on, depending on how ill the person may be. It could be a matter of them still being able to teach in a virtual environment. We know it's going to be a lot coming up on the Human Resources Department with different scenarios, especially with, individuals,
right,
as far as with any type of accommodation, those types of things. So we will be working, expeditiously to get those decisions back out. But that is a good question, because, if the person can still work virtually in that environment during that time period, then we would like for them to continue, especially with the shortage of substitutes.
Thank you. Appreciate it. Dr. Petrie Martin, the next question is also for you. Miss Cox, I think, alluded on it. For the monitors of the isolation room, do you know how early we will have the job descriptions out where we can start advertising?
Yeah, if I'm not mistaken, Dr. Mayo, they are posted. Is that correct?
They've been posted for almost a week now.
Oh, okay.
Yeah, they are currently posted.
Okay, appreciate it. Okay, and the last one, which I talked to Dr. Petrie Martin about, the last one is that we're bringing all staff, not all staff, but all teachers back on March the 15th. What is the expectation for our 12-month employees to include central office?
Right. So we do plan to bring them in earlier than the teachers, because they have to work with the schools to get them ready. So we will have one letter that goes to teachers, and we'll have another letter that goes to our central office folks. We're going to use next week to go ahead and get the building in order. And we also have some training modules that we'll need for staff to go to before they start entering the buildings as well.
So do you have a date?
I think it was the week before.
It's February 22nd.
Chair Pritchett.
Let me pull up my calendar. I think we were looking at either the 1st or the 8th, and because we want to use next week to get the buildings ready and to do some training with staff. But I don't have it in front of me at this time, but we definitely were going to bring them back earlier.
Okay. Do you think, I don't know what the other board members think, but do you think we can shoot for March 1st for all 12-month employees to return?
I'm sure we can. The good news is that our gigabytes at the central office for internet has been improved to 2 gigabytes. So Ms. Alvarez worked on that during the storm. So actually we'll be able to have people back and actually run Zoom meetings with staff in the building without us having unstable connection. If you've ever been on a Zoom with me during the day, you know that I freeze. I've been freezing for months. So that was another thing we had to get corrected if we were going to bring everybody back in and protect them and still do Zoom. So we got that was done today.
Okay.
Ms. Chair.
So things are moving.
Sorry.
Yeah.
I'm sorry, Ms. Chair.
Okay, Ms. Pierce.
Ms. Pam Bell was addressing you. She may have had an answer for you.
Yes, Miss Bell would need to address the superintendent first.
Okay.
Yeah, Ms. Bell, did you want to add anything? I picked up my phone to try to look at the dates. Is there anything else you want to add, Ms. Bell?
No, ma'am. I was just trying to provide it for you so you wouldn't have to look for it, but you gave that information.
You guys are awesome. You're always looking to have my back. I appreciate it.
Sorry, Chair.
Oh, no problem.
Mr. Chair.
Mr. Lundy.
Dr. Petrie Martin, I was glad to hear someone say something. Well, first of all, we do need to get our staff back in here so we can all get reacquainted with the business of education. being in here, and I'm sure everybody's going to do his or her best. That was the example I gave when we talked about when someone said something about substitutes. That's what I meant about what we need. We have a lot of provisional people now, but what are you going to do when people start outing on us? And that's where we go to these people that have these great ideas about coming in on March the 15th, because they must have the answers to how we're going to fill these slots of people that may not be there. And so they were talking about monies being spent for being in when the General Assembly got together, they were talking about things like that, but we never heard any more about that. But we're going to need people.
We will.
We definitely going to need. So that's what I was speaking of when I said our need. Thank you.
Yes, sir.
Mr. Miles?
No, I didn't have a question. I was just nodding. I was just agreeing with Mr. London.
Okay. Any other questions? Like I said, Dr. Petrie Martin, thank you and your staff for the outstanding presentation, for putting this information together. Even though you did, like Mr. Lundy said, even though you all had a plan, you had the plan early, which is great. So all you had to do was go back and do some tweaking, which is great. It wasn't something that you just threw together and say, this is the plan. It was already in place.
Yes,
and like I said, you just had to tweak it. So thank you to you and your staff for what you all have done.
All right.
And I'm looking forward to moving forward. And I'm just excited. You know, I'm just excited that some of the parents are ready to send their kids back. I'm excited about that they're ready for in-person learning. I'm excited that some of the teachers are ready to come back. Ms. Wynn.
So, Chair, I do want to, are we going to get a report or the assessment of how our kids have been doing?
Yeah. So as I said earlier, by Friday, the second quarter benchmark data should be ready, and I'll send that to you all. And then we're hoping by the March 3rd meeting, we can tell you what % by school selected in person. We should be able to give you that on March 3rd.
It's going to be surprising because the 3 levels of Bloom taxonomy, some kids are going to be doing better at home than they will be doing in the classroom.
Probably so. Mr. Pritchard, let me address Dr. Petrie with one more thing. Have we given any consideration to any of our students that may be moving on to John Tyler or Richard Bland, that the need with virtual on this, that there be some support systems, that we work together, collaborate to bring a good support systems, that they go there and have success, not go there wearing.
Right.
You know, I hope that you could, maybe you and your team or whoever could collaborate on that so that our kids won't be worried. I didn't get this. I don't know if I didn't make this successful math-wise.
Right. And we are working with them. They have not opened their doors just yet for in-person.
Right.
But whenever they do, we want to be ready. And Ms. Allsbrooks is our lead to work with them to ensure that we can transition. The other thing that we want to do with this in-person learning is even if high school students do not select in-person, we still want to get them back in for all of their CTE internship hours, because we think it's important for them to get the hands-on as they prepare for certificates and credentials. So we are looking at that for the 4th quarter, and that would involve John Tyler as well, because they help prepare our students for certifications and credentialing. So we're working on that as well, but that Ms. Allsbrooks is working on that, and at some point we even can bring you a update on where we are.
Thank you.
Dr. Petrie Martin.
Yes.
Just share that we are also meeting with those parents and students on an ongoing basis. And just as of the last week or two, there are one-to-one conversations with students just to make sure, just because we're not in person, we're still meeting with them as if we were making those trips over to Richard Bland like we used to. And so Ms. Allsbrooks has done a great job of following up, and we've all just talked with them and making sure that our students are just ready to graduate in May. So they're very present, and their parents are online with us.
Okay, any other questions? Okay, if not, we'll get ready to move to our public comment period. Our public comment period, individuals who are willing to speak. If you are an adult and not a student at Petersburg High, please give your name and address. You will be allowed 3 minutes to speak. If you are a student, we ask that you give your name and the school that you attend. Any questions? Any questions directed to the superintendent or myself? I would ask that you would give us an opportunity to get back with you on those questions, because we have seen a lot of questions posted, and I believe her staff has been answering a lot of those questions. But at this time, I'll open it up for public comment period. You can show by a raise of hands if you would like to speak.
We have one chair.
Why is she not at my top? Oh, I see it now. She came to the top. Okay, the first speaker, Catherine Tucker. She cut her mic off. She may have raised her hand by mistake. Did she cut her mic off? Yeah, I think she may have raised her hand by mistake, because I think her hand has been up for a while. Okay, Mr. Duncan. Go to Mr. Duncan.
How are you all doing?
Just fine. How about you, Mr. Duncan?
Oh, man. Interesting year.
Okay. If you give your address, your name and
Yes,
address.
sir. 1763 East Boulevard, Petersburg, 23805. Most of you know me, I think. And I just had a couple questions or concerns. I do want to say thank you all, because it's been difficult for everybody and what you are doing, and a special shout out to Ms. Bell for what she has done personally at the high school. But my question is, first question, Dr. Petrie Martin had stated that she hoped to have everybody staff-wise vaccinated by March 15th. My first vaccination was supposed to be the 20th, this Saturday, but because of last week's ice storm, and then now we've got this one coming, I won't get my first one until the 27th at the earliest, and it's my understanding it's another 6 weeks before you get the second vaccination. Secondly, I want to follow something Mr. Lundy had said regarding academic progress, and something that ties into that. And again, I think most of you know me and my rapport with the students, not just students in my class, but students throughout the high school. And the biggest issue to get to academic achievement is getting that personal rapport. Students come to me who are not even my students when we're in person, and they will tell me, we don't have food in the home. My mother's boyfriend is, you follow?
Mm-hmm.
And on this virtual, that is destroyed because they don't have that rapport or that connection with the teacher. And I think that needs to be a big development. And going with what Mr. Lundy said, if they want us to reopen and be doing all this, they need to give the support for the emotional issues for our kids.
You still there?
Yeah, I'm here.
Okay. Is that it?
Running out of time, so I will stop at that point.
Okay. Appreciate it, Mr. Duncan. Thank you for all that you do.
And you all too.
Thank you. Uh-huh. Next, we'll move to Miss Wanda Talafera.
Hello, this is Ms. Talafero. How are you?
Just fine. How about you?
I'd like to thank for the presentation was excellent. I'd like to thank all the presenters. It was very informative. But during the presentation, I had a couple of questions, or maybe clarity. Something was mentioned about scheduling, and it said that the students' schedules would stay the same. So what I'm asking, will the teachers change? If you have students who are doing virtual learning and students who are doing in-person learning, will they have, and they're in the same classroom, will they remain will they have the same teacher? Because I heard you say something similar to setting up for CT classes, that they would be able to, the teacher could, because of hands-on, the teacher would be able to do some things with that student. I'm sorry. Would be able to do some things with that student as far as setting up for them being in the classroom at the same time. So is this technique going to be used for the kids who are virtual and in person? The other question that I'm asking is the time frame of the transition. We are now in the third grading period of school. So with this transition to, based on the decision, with this transition of how would it affect the students' grading? Last time when we ended up school in March, there was such a big gap in the students receiving their final grades. So I wanted to know that with this transition, how, as we are into the third 9 weeks, and then we will be into the fourth 9 weeks, how will the grading period, if there is a change in teachers or a change in a lot of things, how would that affect those kids academically for their grades? Okay, I think I'm asking. Those are the two things I wanted to ask. Thank you.
Okay. So, Ms. Talafero, hopefully you can hear me. I switched laptops. Yeah. So we do see our secondary teachers being able to, and this will take some professional development, and we'll have some technology tools, but we do see our secondary teachers being able to maintain with their students, whether they're virtual or face-to-face. But for our pre-K and our elementary students, we think that may be more of a challenge. So depending on what the numbers are, we may have to change students and teachers. But for secondary, our hope is that we would maintain that, the teacher and student. So, and then your other question, I think, had to do with the grading period. We don't see the grading period shifting. As Dr. Daniels said, we'll have some asynchronous days in there, but the grading periods would remain the same. So hopefully I answered your question, Ms. Talafera. Let's see. Let me move over.
I'm sorry, Miss Newton.
Yes, good evening to Chair and Dr. Petrie Martin and the board. Address 1085 Gustavo Lane. I know that there was something mentioned about special plans in place when it came to those resource classes such as art and CTE. What exactly would that plan look like for those particular classes? I know we have been virtual and the class loads have been quite full versus when we would normally be in person. So where you would normally have a class of 15 to 20, our virtual classes are now at 26, 27, 28. And so if we are going to go back in person, what would that plan look like? Because there's, to keep that distance, to have, 27 people in a kitchen, how would that work? What would that plan look like for us?
Right. And so, Miss Newton, of course, we have to have our parents go ahead with the commitment forms so we know exactly who would be in person and who would be virtual. But I will tell you, based on the survey data by school, we could have some schools with only 10% of the students selecting in person, based on what the survey data has told us. So again, we have to look at the data, but we don't anticipate all of that happening at one time, like all 27 showing up at one time based on the feedback we've received thus far. Does that make sense, Ms. Newton?
Yes, absolutely.
Okay.
I was just asking, just in case, like we know that, it doesn't say so right now, but in the event that there was like a whole 180 happen and, everybody decided that, yes, they were going to do that, what would that plan look like already in place?
Yeah, we would have to absolutely shift the current plans that we have and shift locations for rooms and space. So the plan might look quite a bit different than what we've shared this evening, but we would have to totally change what the locations and setups would be.
Okay. Thank you.
You're welcome. Is there anyone else? Okay. Seeing no one else, Doc. Okay.
There is one.
Crystal Cook. Miss Cook.
How are you today?
Just fine. How about you?
Fine. Okay. I was gonna address the newsletter that was sent out. My son goes to Westview, and he's in pre-K, of course. And some of the people that you all partner with, as far as to get some of the lunches and go through and get a couple of dinners, like Sheets. What I was actually wondering, which ones are they? Because I've called several, because some of the kids around in my neighborhood actually can use those lunches, can use those dinners, but they're not actually offering them. And when you call and ask, are you offering the lunches or whatever have you, they're very rude, they're very nasty, we're not giving away free food, so forth and so on. So I don't know where to direct people to actually go, because it's a couple, like I said, a couple of families in the neighborhood that can actually really use it, because this outage has really caused them to lose a lot of food. It's a lot going on.
Miss Cook.
Yes.
Yes. Now the Sheets app is the one that I sent to the PR person when all the Sheets first announced that they were giving lunch, and that was the early part of the pandemic. They stopped that a while back.
No, it was actually a newsletter just sent out recently.
I think somebody else said it most recently.
Oh, okay. Okay. So it's not mine then. Okay.
So, Ms. Cook, what we might have to do is we collect these because we think it's of help to the community to kind of share them. But what I'm hearing, Ms. Cook, is we might have to do some of our own due diligence to make sure those things are still active.
Yeah, but even before, they were actually turning people away.
Oh.
So, I guess I just had a concern after I saw the newsletter and knew of some people that were actually going there trying to get the lunches. And I guess especially when we had the outage and they were just turning them away.
Thank you for bringing that. Thank you for bringing it to our attention. Yeah, but like the superintendent said, as we come across information or anything like that, usually we try to share it with the parents. It's just that we just probably need to look at the end date or whatever and remove it from our our site. If it's on our site, or if we're putting it in a newsletter, we just need to make sure that we stress the end date.
Okay.
Okay.
Okay. Well, thank you.
Not a problem. Okay. Is there anyone else? Okay. Is someone coming through?
That I'd like to address, if possible. Chair, may I address?
Yes, Madam Superintendent, I'm going to let you address this one since it's...
Sorry.
Go ahead.
So we've seen several folks who have asked questions about the vaccines. I am working behind the scenes to get some clinics moved up in time. So let's all think positive thoughts, and then hopefully we can get that to happen so we can meet the expectation of March 13th, having all of our doses completed. So just know I'm working hard to make that happen.
And did you announce that the clinics are not happening this weekend, right?
So our vaccine clinic on Saturday is happening.
It's still happening, okay.
But the Friday community vaccine clinic that was happening here will not be happening. So Friday clinic is off, Saturday clinic is on currently.
Okay, thank you. Is that it? That's it? Okay. I want to thank everyone for their comments. Thank you, Dr. Petrie Martin and your staff for answering questions. At this time, we'll move now to our action item, 6A. Dr. Petrie Martin.
So during this time of year, we have the opportunity to celebrate different areas of work. And so,
6A is your recommendation.
Oh, I'm sorry. I didn't realize we had changed it on this agenda. So with that being said, and all of the good discussion that we've had this evening, I am going to bring forward a recommendation. And the recommendation has two parts, but it is one whole recommendation. And that is, the recommendation is to provide 2 family options to include the Petersburg Virtual Academy or in-person instruction, with 2 phases for beginning in-person instruction. Pre-K through 5th grade students would begin on March 17th, and 6th through 12th grade students would begin on April 12th.
Okay. You've heard the superintendent's recommendation. Is there a motion to accept? Moved by Mr. Lundy. Is there a second?
Second.
Mr. Miles, all in favor? Aye. Opposed? Motion carries. Congratulations, Dr. Petrie Martin. Next, we'll move to 6B. Those are your proclamations.
All right, now we're moving on to our proclamations for this month. The first one is that we definitely want to recognize this February as Career and Technical Education Month, and we have a proclamation that reads, whereas economic and technological changes in society are rapidly reflected in the nature of today's workplace, thereby placing new responsibilities on Virginia's education system, and whereas Career and Technical Education provides the Commonwealth students with a career pathway for post-secondary education and workplace readiness in a global economy, and whereas Career and Technical Education gives students experience in practical, meaningful applications of basic skills such as reading, writing, and mathematics, which promotes deeper learning and improves the quality of their education, and whereas Career and Technical Education is the foundation of a strong, well-educated workforce, which fosters productivity in industry and contributes to Virginia's leadership in the international marketplace. And whereas Career and Technical Education offers lifelong learning opportunities that provide individuals with more career choices, expanded earning potential and greater job satisfaction. And whereas the cooperative and ever increasing efforts between career and technical educators, administrators, and representatives of business and industry stimulate the growth of the Commonwealth's economy by preparing students for careers in high demand, high wage, and highly technologically skilled areas. And whereas the national theme of Career and Technical Education Month is Celebrate Today, Own Tomorrow, demonstrates the crucial role that career and technical education plays in readying Virginia students for successful careers. Now, therefore, the Petersburg School Board and Superintendent do hereby recognize February 2021 as Career and Technical Education Month in the Petersburg City Public Schools this 17th day of February 2021 and call this observance to the attention of all of our citizens. We ask that this proclamation be approved.
Thank you, Dr. Petrie Martin. You heard the superintendent's recommendation on the proclamation. Is there a motion to accept?
So moved.
Moved by Ms. Nguyen. Is there a second?
Second.
Mr. Pierce, all in favor?
Aye.
Opposed? Motion carries. C.
The next item is another recognition because the week of February 14th through 18th of 2021 is Virginia Kindness Week. And we have a proclamation that reads, whereas the purpose of Kindness Week is to recognize that simple day-to-day acts of kindness enable our schools, communities, and city to be a kinder, safer, healthier, and more inclusive place to live, work, learn, and play. And whereas kindness helps us to form meaningful connections with others, which are reported to be a strong factor in increasing happiness. And whereas kindness has been proven to boost serotonin, reduce stress, increase positive affect, release endorphins, and the hormone oxytocin in numerous scientific studies. And whereas teaching and recognizing kindness in schools and communities fosters empathy, builds community, reduces bullying, and nurtures a safe and welcoming environment. And whereas by promoting kindness, we are promoting inclusivity by extending an opportunity for grace, empathy, dignity, and acceptance to all citizens of our city. And whereas practicing and celebrating kindness is to look for the good, bridge the connections across differences, restore hope, and empower people to make our community strong and resilient. And whereas the Petersburg City Public Schools can lead by example in promoting positivity and supporting a culture where schools, localities, businesses, organizations, and individual citizens can come together to acknowledge, connect, and promote kindness in our communities. Now, therefore, the Petersburg School Board and Superintendent do hereby recognize February 14th through the 18th, 2021 as Virginia Kindness Week and call this observance to the attention of all of our citizens. We ask that it be adopted by the School Board of the City of Petersburg on this 17th day of February.
You've heard the superintendent's recommendation for the proclamation on Virginia Kindness Week. Is there a motion to accept?
So moved.
Moved by Mr. Pierce. Is there a second?
Second.
Mr. Miles, all in favor?
Aye.
Opposed? Motion carries. Next, we move Dr. Petrie Martin to 6D.
So it is the time of year where the Virginia School Boards Association honors businesses and partners by resolution. And this year, we have selected 3 of our partners to receive the VSBA Business Honor Roll recognition. Those 3 partnerships include the Central Virginia Health Services, Communities in Schools, and the Claude Moore Scholars Foundation. And their resolution reads, Whereas public schools and local businesses are an integral part of this community, and whereas many local businesses play a crucial role in supporting our schools, and whereas the economic health of our community, state, and nation depends on a strong public school system, and whereas collaboration between local public schools and local businesses strengthen schools and the business community alike by providing a well-trained and highly educated workforce, and whereas an excellent public school system is vital to the quality of life in this community and fundamental to preserving a strong democratic society now and in the future, therefore be it resolved that Petersburg School Board names the Central Virginia Health Services Incorporated, Communities in Schools, and the Claude Moore Scholars Foundation to the 2021 Virginia School Boards Association Business Honor Roll, showing appreciation for the firm's ongoing support of this community's public schools. Your work has aided this community in focusing on the goal of providing the best public schools we can for every child who attends them. We ask that these resolutions be adopted by the school board of the city of Petersburg this 17th day of February.
Thank you. Thank you, Dr. Petrie Martin. You've heard the superintendent's recommendation for the 3 organizational businesses for the business honor roll. Is there a motion to accept?
Move to accept.
Moved by Mr. Miles.
Second, Mr. Chair.
Mr. Pierce, all in favor?
Aye.
Opposed? Motion carries. Thank you, Dr. Petrie Martin. At this time, board members, we move to number 7, our information item. I've already spoken, well, Mr. Rios has already sent Mr. Squires our email. I'll be speaking with him in reference to that report based on information from our attorney. B, our next school board meeting is scheduled for March the 3rd at 6:00 p.m. right here at Petersburg High in our cafeteria. And also, I'm not sure, I look like someone has a committee report attached. I can't see it, but someone did put a report in there. It's from Code RVA. So if you get an opportunity, please look at the report that Mr. Lundy has provided. Mr. Lundy, did you have anything to say about that, or you good?
No, we're good about that. The only thing I want to say is they're having a national.
I think are you on mute? It's your mic. Where's your mic?
Code RVA has already given their graduation dates, and they're having a celebration of student work showcase. And it's like a science fair. I was telling Ms. Barrios that I checked with them to see could we open it up to the board and the community. I got no response back, so I didn't move forward with sharing. Because the person that I was in contact with, I waited for them to respond back to me, and I didn't get a response.
Oh, okay.
Oh, no, it was Code. It was the person at Code RVA that put the showcase together, and it's about work and different styles of work.
Okay. All right. Thank you. That's it.
Yes.
Thank you, Mr. Lundy. We move to D, new business from board members. Any new business announcements? Okay. And Dr. Petrie Martin, I believe you all, I've seen the messages, but school is closed tomorrow.
Yes.
The learning is also closed tomorrow.
Yes. Yes, sir. And we are anticipating some power outages as well tomorrow.
Okay.
We hope that doesn't happen, but.
Okay. So we're asking everyone to please be safe, stay warm, and we hope to see you on March 3rd. At this time, I'll take a motion to adjourn.
Move to adjourn.
Moved by Mr. Miles. Is there a second? Ms. Nguyen, all in favor?
Aye.
Opposed? Motion carried. This meeting is now adjourned. Have a good night, everyone.